Sex does not cause, alcohol does not cure. The Public Health Center refuted myths about prostate cancer. Important. This material is based on current scientific research, is for informational and reference purposes only and cannot be used as a basis for medical diagnosis. To establish a diagnosis, be sure to consult a doctor. Prostate cancer is a malignant tumor that develops in the prostate gland and is one of the most common types of cancer among men. There are many myths about prostate cancer treatment. In particular, some people mistakenly think that cancer can be cured by tinctures or vitamins, and prevented by abstaining from sex or drinking alcohol. The Center for Public Health refuted 5 false theses about prostate cancer. We should be careful with unconfirmed theses that have no evidence base. We suggest to refer to the facts, the CDC wrote. Myth number 1. Sex increases the risk of prostate cancer. Truth. Sexual activity does not increase the risk of prostate cancer, the Center for Public Health emphasizes. On the contrary, studies have shown that men who report more frequent ejaculations may have a lower risk of developing this type of cancer. In particular, in 2016, scientists found that ejaculating more than 20 times a month reduces the risk of prostate cancer by about 20%, compared to ejaculating 4 to 7 times a month. This applies to both 20-year-old and 40-year-old men, the Harvard School of Public Health says. So don't believe the rumors that high levels of sexual activity increase your chance of getting sick, the CDC says. Myth number 2, vasectomy causes prostate cancer. Previously, there was a thesis that vasectomy, male sterilization surgery by ligation or removal of a fragment of the vas deferens, increases the risk of cancer in men. Experts of the Public Health Center say that numerous studies have refuted this thesis. But recent studies show that vasectomy may lead to a slight increase in the risk of prostate cancer, Healthline writes. In particular, in a meta-analysis of 2022 studies, it is said to increase the risk by about 6%. Scientists debate whether this small figure is clinically significant. At the same time, vasectomy does not increase the risk of advanced prostate cancer or death from prostate cancer. Read also, Cancer in Men, What Services Are Available for Free? Explanation of the NHSU. Myth number 3, acetylsalicylic acid cures prostate cancer. In fact, acetylsalicylic acid cannot be taken to prevent prostate cancer. There is a myth that some medicines, in particular those containing acetylsalicylic acid, should be taken to prevent prostate cancer. We urge you to take medicines only as prescribed by a doctor. Self-medication is dangerous to health. The Ministry of Health says. Myth number 4, to avoid cancer, you need to drink alcohol. In fact, alcohol does not reduce the risk of prostate cancer and does not cure this disease. Currently, no direct link between alcohol consumption and prostate cancer has been found. But it is known that an unhealthy lifestyle and alcohol consumption increase the development of certain types of cancer, the CDC said. Also, a Canadian study showed that men who already had prostate cancer and drank more than 8 alcoholic drinks per week had a higher mortality rate than non-drinkers. Myth number 5, to protect yourself from prostate cancer, you need to take vitamins and supplements. In fact, special supplements and vitamins do not protect against cancer. In advertising or on the internet you can see information that vitamin E and selenium prevent the development of cancer in men. Studies show that there is no link between the use of vitamin E or selenium and the prevention of prostate cancer, the CDC emphasizes. No clinical studies have shown that specific vitamins or minerals and other supplements can prevent prostate cancer, the CDC says. See your doctor and get advice on how to reduce your risk of developing this type of cancer, the doctors advise. Also, regular preventive examinations are the best way to prevent cancer. Earlier, scientists found that coffee can help prevent prostate cancer and increase the chances of survival by 16%.